Hi, this is my pharmacology video presentation. Anxiety disorder. There are three different types of medications to take that can manage symptoms. The first line of medications includes antidepressants, mood stabilizers, anticonvulsants, and atypical antipsychotics. These can include Lexapro or Prozac. Um, the second line of medications that can be used to help treat anxiety are benzodiazepines. These are often used when a client maybe has a lot of anxiety attacks or panic attacks. And the next line of medications that could be used for anxiety would be kind of any kind of experimental or investigational medications. But an alternative for medications to treat anxiety disorder would be using like cognitive-based therapy or CBT to be learning those coping skills to reduce distress when anxiety is high. Moving on to bipolar and mood disorders, the primary medication that's used to treat these is antidepressants, which again is like a Lexapro. The secondary type of medications that is used to treat these kinds of disorders would be a mood stabilizer, and then the next type of medication that is used in disorders would be an atypical antipsychotic medication. But a treatment approach without using medications would be trying talk therapies and behavioral therapies. These can be really helpful to get feelings out and kind of off their chest, and to find new ways of coping that are actually healthy. Moving on to our personality disorders, the first line of medications for these uh, would be an antipsychotic medication. Um, these ones can help with manic episodes and limit the amount of anger and suicidal thoughts that are happening with personality disorders. The second line of medications is neuroleptic medications, which is a different class of an antipsychotic. The third line of medications would be mood stabilizers and anticonvulsants. Lithium is one of these, which is used to treat borderline personality disorder and can be very helpful in reducing affective instability. Another treatment approach that could be helpful with personality disorders would be dialectical behavioral therapy or just talk therapy, so a DBT approach. Moving on to our schizophrenia spectrum. The first line that schizophrenia spectrum disorder of medications would be the first generation of antipsychotics, which can help with reducing episodes and instability that happens with these kinds of disorders. The second line would be that second generation of antipsychotics, which are the atypical antipsychotics. These ones are proved to be a little bit more tolerable, so maybe a little less side effects with these ones. Um, and then the third line of medications for these disorders is a long-acting injectable antipsychotic. Um, these can help with improving the quality of life for clients who are suffering with schizophrenia spectrum disorders. Some other treatment approaches for these disorders can include family intervention, psychoeducation, and CBT. With the psychoeducation, it's more so just kind of bringing awareness to what a schizophrenia spectrum disorder looks like and how we manage it as clinicians and stuff like that. Moving on to trauma and adjustment disorders, the primary medication for these ones is going to be a selective serotonin reuptake inhibitor or an SSRI. The second medication that could help these disorders is a benzodiazepine. And then the third level to treat these is etifoxine. These can all be used for these disorders depending on the type of severity that there is. And another treatment approach, again, without including medication, is going to be those psychotherapies that are more trauma focused. Moving back towards our anxiety, some limitations of the medication with anxiety is that uh, using medications, uh, the client could become dependent on them to ease their anxiety, and they may have to keep increasing their dosage or taking a different medication, which takes time to go into effect in the body. And they're just going to have to keep increasing and increasing for it to stay working in the body. And becoming dependent on these could not really offer a lot of long-term coping mechanisms. Um, Medication is also there to offer quick relief to the anxiety, but it's not going to help like the underlying causes of the anxiety disorder, which is what we really want to tackle when we are treating these kinds of disorders. So things that could help on top of taking the medications is making sure that they're in some sort of therapy, like a CBT program, and stuff like that, just so that we're also getting to the bottom of what the anxiety is actually coming from. Again, moving on to the alternative treatments for anxiety. One of these could include psychotherapies such as CBT. Um, this one is going to help clients find alternative ways to cope with their anxiety using skills such as like deep breathing, or maybe the TIP skill, which stands for temperature intensive exercise, paced breathing, and progressive muscle relaxation. So a big thing with this is kind of changing your temperature. So using an ice pack or something along those lines um, can really help change the body and what it's thinking in that moment, because it's going to be so focused on the temperature change rather than what is going on in our head. Another treatment that can really help anxiety is to minimize stressors with a lifestyle change, such as maybe reducing the consumption of alcohol that we're drinking. Um, Moving on to social workers' responsibility to the broader society with medications specifically. It's been a massive problem in the United States that we are over medicating our youth because of big pharma, and how easy it is to get medication for disorders. Um, it's become increasingly more common, and instead of taking other treatment approaches, such as maybe behavioral or talk therapies, we're just giving them medication. And actually getting over medicated at a young age, or even getting medicated at the start, can increase the issue of development in children, and it can run the risk of further complications when they get to be adults. And if we're treating with medications too young, that individual can actually become just too dependent on medication. And once maybe those medications stop working, or they stop being prescribed because they're not working anymore, it could lead to maybe an addiction of medications that are not prescribed. And they could be finding them on the street or something along those lines, and can lead to a much bigger problem than maybe the anxiety that they were getting treated for before.